Welcome to the National Women's Fitness Academy podcast. We're here to talk about women's health, female hormones, body image, and all things health and fitness. All right. Hello, girls, and welcome back to another episode of the Women's Fitness Academy's podcast. I'm your host, Siggy, one of the WFA's educators and a mindset and body image coach. Today, I am sitting with the wonderful Lara Briden. For those who don't know Lara, she is a naturopathic doctor and the best-selling author known for her books, which I literally have both of mine right here. I'm kind of girl fanning right now, just FYI. Her first book is the Period Repair Manual. For those who are watching, I'm holding it up. And it is a guide for every woman's insight to how to better their periods and using natural treatments. And it also contains advice and tips for every age and situation. And then her other published book, which I absolutely love, is the Hormone Repair Manual, which is for every woman's guide to healthy hormones after the age of 40 using natural treatments. And it covers perimenopause, menopause, and so much more. Now, again, for those who don't know Lara, she's had over 20 years of experience in women's health and currently helps women with various hormone and period problems. Now, Lara also has a very strong science background, which is involved in a lot of advocacy boards and peer-reviewed papers. Can you tell I'm very excited about today, Lara?
That's great. I love that you have my books right there to show. That's nice.
I love them. I honestly, your first book, the Period Repair Manual, opened so many gates for me to heal my period, because I was one who was on the pill for over a decade. And when I came off it, I lost my period. And I was trying to.
Well, you didn't, I mean, the period bleeds on the pill aren't periods. So you just didn't have a period. You revealed that you didn't have a period.
Yes, exactly right. And thank you for correcting me.
Yeah.
And again, this is something that many women are not familiar with or don't understand. So let's dive into that straight away. The difference between a pill bleed and a natural bleed.
Yeah. I mean, I'm a big fan of using the right words for things. So one of the best examples of the wrong words has been, for the last really only 50 or 60 years, this referring to a drug-induced bleed, the pill bleeds, as periods. I mean, they're the same in that they're bleeds, but in every other way they're different. Like a menstrual cycle, a proper menstrual bleed comes at the end of a series of hormonal events, including, most importantly, ovulation. And that's why it's monthly. So whereas with the drug-induced bleeds, it was entirely a marketing thing. They thought, well, this will seem more natural or more acceptable if we induce the bleed every month, but there's no medical reason to do that. So on the combined pill, there's no medical reason to have a monthly bleed. On the combined pill, which suppresses ovulation, like women, it's probably a good idea to maybe have a withdrawal bleed every few months, or you start to get spotting, but that's it. Like this, it's not a period. And so one of the weirdest ever things in medicine, surely it will have to go down as one of the strangest things, is the prescription of the pill to regulate the menstrual cycle when it doesn't do that. It actually suppresses the menstrual cycle. It puts women in kind of a really sort of like a temporary menopause state, at least in terms of their own estrogen and progesterone, which are suppressed and which are not replaced by the pill, because the drugs in the pill are not the same as our hormones, which is something else that's really important to understand.
It's such an insightful way of looking at it, because too often we've been told by professionals that, again, the pill will fix your period pain, will fix your acne, go in it. But as you mentioned, it just masks the whole issues. And then once we do try to come off the pill, then all these symptoms come back on where we have been struggling with for years.
Yeah, 100%. I mean, it does, there's no question it can mask symptoms and it can do that very well, particularly skin. But the problem is there's always a price to be paid. It's not free, because what happens then is you try to come off those particular drugs, especially pills like Yasmin or some of the ones that really strongly suppress skin oils. When you come off, eventually you can get this rebound acne, what I call post-pill acne, that is horrendous. Like, I've had patients say they've just never really knew that skin could break out that much, and it's quite frightening when you go through it. So I guess with my own patients, I say, let's find another solution from the get-go, like from the beginning, so you never have to pay that eventual payment of post-pill acne.
Well, I was one of those people who did experience that after the use of Yasmin. And interestingly enough, when I was going through that phase of coming off the pill, I actually wanted to go back on it due to the symptoms.
Of course. And I have so many patients who say they're, because as women, we blame ourselves, we tend to. So I have lots of patients who, if they come off the pill, and it's not immediate, it usually takes about 3 or 4 months for the skin to really ramp up and start to get bad. And so there can be a lag time, which can be a little confusing. And then patients will say, oh my goodness, well, I must need the pill then, because look at how bad my hormones are, how bad my skin is. It's like, well, that's actually not necessarily all you. I mean, some of that is just withdrawal, like a side effect from having been on that drug for a few years. I mean, that could happen to almost not anyone, but I mean, a lot of people, if they went on those anti-acne drugs and then tried to come off, they're potentially going to get
when
withdrawal.
coming off the pill, you mentioned just now how it tends to take about 3 to 4 months to, I want to say, regulate, quote unquote, because it's going to be very different to each and everyone. But what are some natural treatments and lifestyle changes that you do advise clients to do to make better ways of living after coming off the pill?
Yeah, the way to think about it, because there is definitely no one size fits all. It really depends entirely on what the symptoms were that the pill was suppressing, right? So we've been talking about skin. So, I mean, obviously I have a set of recommendations for how to calm down and deal with post-pill acne, but then you might have someone who their main thing was they just weren't getting periods. And they went on the pill to regulate their period, and they got these pill bleeds, forced bleeds, basically. And then when you take the pill away, then you're still left with the same problem that was always there, whether that was undereating or in some cases polycystic ovary syndrome, two things which actually can look quite similar and actually need very different treatments. So that's one situation where it's very important to try to get the correct diagnosis so you can get the correct treatment. Another scenario might be pain. A lot of women might have taken the pill to deal with pain and then come off, and the pain is still there, and so they need something different. Again, there are some overlaps in treatment, fortunately. I mean, one of the ones you would have seen in my books, and I do often mention, is a couple things that often get repeated again and again. So avoiding normal cow's dairy can lighten flow, improve skin, and also improve premenstrual mood symptoms. So because of the inflammatory reaction if some people have to normal cow's dairy, can manifest as pain or mood or breakouts, like in all those different ways. So that's one thing that can often be quite helpful. And I do say normal cow's dairy because I truly find clinically that women can often get away with having goat or sheep or A2 dairy. They can feel good on that. And that's great because it means they can still have that food, which is obviously dairies can be quite healthy otherwise. And then another one is zinc, which I do mention quite a few times. But zinc can be a game changer. There's actually been a couple of clinical trials of zinc for period pain in teenagers, which I love. I recently did sort of a masterclass on periods for teenagers, and we talked a lot about zinc for skin, for period pain. And I like it for young women and teens because it's quite simple. It's just, one pill. It's, inexpensive. It's just an easy treatment that can help a lot of things.
It's an all-rounder with zinc. I've noticed such a big change when I started supplementing you with it.
Yeah. Yeah.
Um, it's really, especially for those with PCOS, as you mentioned too.
Yeah. It does. It has an anti-androgen or kind of anti-testosterone effect in a good way. I
Yeah.
always, because I say that, women who have androgen excess or too much male-like hormone or too much testosterone need an anti-testosterone approach. That's beneficial for them for lots of reasons. But that does not mean, to be clear, it does not mean it would never push testosterone below normal. And men can take testosterone. It has a pro-testosterone effect for them, right? Like it's all relative. It helps to normalize the system. So don't worry, it won't push testosterone below normal if anyone's scared of that.
It's us debunking the myths right now around zinc and
Yeah.
testosterone.
Yeah. Yeah. Have you heard that people worry it'll
Yeah.
push testosterone too low? It's like, no.
It doesn't work like that.
No.
Oh, it's too funny. I want to make another point regarding the lifestyle tips that you've brought up. You also mentioned something around period pain, but also like PMS and so forth. And too often I come across clients and women thinking the pain they're experiencing is due to that time of the month. However, I want to shed this light on them to making them understand that it takes more than just 1 month, from studying. Right. And I'm sure you can explain this further in depth. As you mentioned, it's improving your lifestyle within 3 months because it does take 100 days to take your follicle, to go from a doormat to mature and changing those habits within your body.
Right. So I do talk about the 100 days to ovulation in Period Repair Manual. Yeah, that can apply to period pain to some extent. We can talk about that. I was also mainly talking about in that part about regulating the cycle. So that, because if you're trying to get your period back or get your period more regularly, there is always going to be a lag time because of it takes 100 days to ovulation, basically. And that's ovulation is what gives a regular cycle. And so that can work in both directions. So as I'm sure you know, and many of your audience would know, women can lose their periods to overtraining or under eating. That's a common thing. And that is not immediate. That takes 3 or 4 months or longer in the other direction too. So you can do it, be training at that level for a while and think, oh, it's good, it's fine, I'm still getting my period. But a few months later, it's like, oh no, I'm not. So, and conversely, going in the other direction, like fueling better and eating more, and to try to get your period back, you almost have to give it at least 6 months to see the results. There can also be for other things too, for pain. Yeah, there is some cumulative effect sort of over time. And you also, what I say to patients is you want to have a sample size of periods too. Like you don't just want to try something and say, what is this period, my period a week later like that's not enough. Like you need, because periods are affected by so many different factors as well. So you need to give it when you're starting a new treatment, you need to give it a few cycles just to start to get a sense of how is this on average now. That can account for, anybody can have, a cycle when we're worse PMS, like worse premenstrual mood or something like that. I mean, that could just be from stress in that month or jet lag or, something like that. So we have to account for that.
Yeah. That's so interesting, especially having a better understanding that it's individually processed for every person, where, as you mentioned, like the cycle side of things, you have to put more practice into it to see what actually helps to implement a better period health. Yeah,
you have to play the long game, as I say in Period Repair Manual. You have to make some decisions. I mean, yes, if it eventually is not working, then you're going to want to try something else, but you don't want to chop and change too quickly. I've had patients who did that. It's like, I tried this for 2 weeks and then I tried this for 2 weeks. It's like, when you're dealing with periods, that's not long enough. Yeah.
Yeah. So I think maybe some of our listeners will be like, oh, maybe that's me, that every 2 weeks I'm changing, because that's very relatable to health and fitness as well. Too often people get sick of doing the same exercise, but they don't realize the benefits of doing it long-term consistently.
Yeah. Yes. Especially for metabolic health, play the long game. Yes.
Yeah, it's so, so interesting. And we know that it has a correlation how hormones change, and particularly during once we get to an age where we experience more perimenopause and menopause,
Yeah.
and it can be quite challenging for some women. Would you mind providing an overview of some of the principles outlined in your hormone repair
Yeah.
manual that will help women, using more of natural treatments for it?
Yeah. So the first thing to understand is that symptoms can start a lot earlier than you expect. So I think some women, or certainly young women I've talked to, have this sense that menopause is off, like, oh, it's off when you're 50 something. In fact, I had a 41-year-old woman say that to me. It's like, oh no, I think that's a good thing menopause is, ages away. It's like, oh no, sister, it's soon. So by our early 40s, usually there's starting to be something changing. It does vary between individuals. There's about a 10-year kind of variation. So it's to do with sort of the normal timing of menopause can vary by about 10 years. But it's not unusual for someone to be noticing either mood changes or heavier periods or sleep disturbance or even some night sweats by early 40s or even late 30s. And that's normal. And those early stages of what's called perimenopause, which is the time leading up to the final period, those symptoms are primarily from losing progesterone, starting to make less progesterone, which is the second female hormone. Usually there's quite a lot of estrogen around in those early parts of perimenopause. So that's a time when actually as I explain in the book, taking estrogen isn't really going to do anything, because it's actually the body trying to adjust to lower levels of progesterone that is what's happening. And taking progesterone or natural progesterone, I talk about that in the book, can be one option, but there's lots of other ways to help both the brain and the metabolism recalibrate to the new levels. So one of the things that, unfortunately, weight gain is one of the things that starts to happen in women's 40s, is a redistribution of fat to the abdominal area, kind of quite a change in body shape, which can be quite frustrating if you don't realize there's an underlying hormonal aspect to that. You just think, wait, like I'm doing everything the same, and my body's changing, and that's part of it. So in my book, as you know, I tried to sort of destigmatize that and just frame it as this is a natural thing that we evolved to do. It's not an accident of living too long. There's nothing shameful about getting older. It's a blessing to get older, actually. It means we're still here. So yeah, and just to say again, during perimenopause, it's equally important to not shut down the menstrual cycle with the pill, basically. I mean, and there are hormonal ways to work with some of those symptoms that don't involve just taking contraceptive drugs. So yeah.
Can you share a success story? I know there's like probably many, but something that will highlight more of the positive impacts of natural treatments for women's health, especially for those who are reaching closer to the menopause phase of their life.
Yeah, absolutely. The one that comes to mind, I've got my book here. I'm just going to I just make sure I get the name right. There's a patient story in my book, in Hormone Repair Manual, that comes to mind. That's Bernadette. So that's, I forget what chapter she's in, but this is the other thing, just to give an example of what can be confusing. That's in chapter 8. She was really sure that the problem was, so she wasn't sleeping, she wasn't coping with stress as well. She was, not sleeping as well, and noticed some changes in her body weight, all the things I've just been talking about. She was, I think, 40, maybe 46. And also had a thyroid problem. If your audience would know, thyroid hormone is also important for women's health, or everyone's health. But she'd been, her main thing, I thought my doctor can't get my dose right of my thyroid hormone. She could kind of go up and down with the thyroid hormone. But meanwhile, I'm like, well, you're 46. Like, there's some obvious other things happening here. So in her case, her doctor had never raised the possibility that perimenopause was playing a role in especially those neurological symptoms. And so we did my favorites from Hormone Repair Manual, a nice magnesium powder and with the amino acid taurine. And she did natural progesterone, which in Australia is prometrium, and she felt a lot better, and she was sleeping and felt like she could cope at work again, and she still, but the funny thing I remember about her case is even like 10 months later into treatment, what we'd done had worked, but she was still very resistant to the fact that it could be perimenopause. I think she was one of many patients I've had who felt a real stigma around it and kind of didn't want to name it. She wanted to just think, okay, those treatments are working, but for another reason. It's not. Yeah. So I actually think the treatment of perimenopause is where natural treatment shines, because the medical model doesn't have a lot for it, really. They would tend to prescribe the pill, antidepressants. Lately, there's been a push to take menopausal hormone therapy or estrogen therapy into women's 40s, but I just don't think estrogen works that well. Often they're giving it with natural progesterone anyway, because that's kind of the protocol. So then I'll say to patients, I think it's the progesterone part of it that's actually working for you. So, yeah.
I find that so bizarre that they're still implementing the pill for those who are experiencing perimenopause.
Yeah. Well, it's a form of hormone therapy, right? Like it's a big dose of estrogen in most pills. Well, the actual dose of the synthetic estrogen is not that high, but it's very strong estrogen. So it will tend to kind of, once again, kind of mask the situation, just shut down the fluctuations and give back this, synthetic estrogen, which is not as good for anything, for brain health, for bones, for metabolic health, as women's own estrogen. So yeah, there's lots of areas. It's a fun, to say, where has natural medicine performed well in women's health compared to conventional medicine? I would say in almost every area, in terms of, I mentioned earlier, like, the attempts to regulate the cycle with the pill was bizarre, so all the other natural treatments, such as, for example, here's an example, the supplement inositol has been clinically trialed so many times for polycystic ovary syndrome, for lowering androgens, for promoting ovulation, for regulating cycles, for promoting fertility in those women who want to fall pregnant. And it's a superstar in terms of every study, it does well. It's done well in these, meta-analysis where they review all the different studies and combine the data. So, and again, it's working by actually helping the body do what it's trying to do, which is to ovulate and have a natural menstrual cycle, as opposed to shutting it down. So, it would be an exaggeration to say natural medicine is better in every situation. There's obviously times when surgery is required. There's going to be situations when something is required. But when it's really just kind of functional, what are your hormones month to month, almost the only tool women have are natural treatments. There's not much medicine can do for that.
I love the fact that you brought up inositol, because I literally swear by it, aside from zinc, and also Vitex as well. Yeah. I've noticed that Vitex has been quite a powerful healing process for my periods as well.
Yeah, it can help to promote ovulation and regulate the cycle. It can help with calm down premenstrual mood symptoms often. It's also called chaste tree. I'm sure most of the audience today knows about that. It's a very, very popular herbal medicine for women's health. I like it. There are times when I find it's not the right choice. And that would be, in my experience anyway, that would be in the true kind of a stronger androgen PCOS picture, like not just some post-pill acne, but like, a stronger, kind of more hardwired high testosterone picture. I find Vitex is not the greatest for that, but fortunately there's inositol and other options. And yeah.
Well, that's so good to know. And while we're on the topic of natural treatments and a little bit about the medical practices, I want us to dive a little bit deeper if we could discuss the importance of, as you mentioned just now, the evidence-based natural treatments and their role for improving women's health, and how do we bridge the gap between, traditional naturopathic medicine and the mainstream medical practices?
Way to bridge the gap is to reframe the goal. Like as soon as you shift the goal to, I want to have a regular ovulation, it changes everything, because that's when, kind of what I was just saying a few minutes ago. I mean, that's obviously, the pill can't do that. So that's when, the sort of knee-jerk reaction to just put everyone on a pill is just not going to work. So then there has to be, then there's like, the gap is bridged, because then everyone has to, doctors have to think, okay, right, okay, well, what would actually work to do that, to promote natural menstrual cycles? And that's where something like inositol could come in. I mean, a lot of doctors are quite open to the idea that, what you eat and sleep and reducing stress can help with menstrual cycles as well. That hopefully that, is making sense to more doctors. In terms of evidence-based, like, there's always going to be a mix of things. That's true in natural medicine and conventional medicine, actually, that some things are more evidence-based than others, for sure. Inositol and zinc are probably in some ways, the most evidence-based. I mean, the research around those is absolutely rock solid. Some of the other things, the diet changes, and we have to wonder, are they ever going to be evidence-based in the sense that, like, no one's ever going to, well, I say that. I was going to say no one's ever going to test what coming off dairy can do to periods. But I know actually at Deakin University, I hope I've got this right, I'm pretty sure they were looking at removal of normal A1 dairy in terms of its impact on premenstrual mood. So I've been trying to keep an eye on that study and wondering if that will come around. And there's a lot more research into the role of, for example, the microbiome in pelvic pain and a condition called endometriosis. So that's another area where we might start to get a bit more evidence-based. But, in my work, I've had to be ahead of the curve, obviously, in a lot of things. I remember one of my teachers saying, 30 years ago, it's like, if you wait for the evidence, all the evidence, like, to be rock solid, you'll be waiting forever. So, I mean, part of it is weighing up to, like, risks versus benefits. So, it's easier to try a treatment, just try and see if it works, if it's a treatment that isn't going to do any harm, like, changing from normal dairy to A2 dairy. There's no harm from that, even if it doesn't work. So that's often how I approach things.
It's so good to have a better understanding of how we can approach it in a way that's more realistic. And as you mentioned, if we're waiting for the evidence, it's just going to be waiting forever. It's like simply placing and taking into account, again, like your diet, your lifestyle, but also like natural therapies and, medicine when it is needed.
Totally. I remember this, one of my favorite Amazon reviews that I ever got on Period Repair Manual. I should go back and find her exact wording, but it was something like, oh my goodness, I had no idea that what you eat can affect your periods. It's like, yeah, it can. And the fact that was so surprising to her and so surprising to people is actually, if anything, it just says how much science has failed in terms of, communicating. Like, our menstrual cycles are not separate from the rest of our body. So it totally makes sense that what's going with us generally is going to show up. It's going to be expressed in, periods and period symptoms. So again, that's a way to bridge the gap, is to kind of see things through that lens. So I talk about in Period Repair Manual, I talk about our period being our monthly report card. And then in Hormone Repair Manual, I talk about the whole perimenopause transition as kind of like the final exam in that same, analogy. And I say that gently. I mean, I do understand there's always some women get, just a curveball, something like endometriosis that is not something they did wrong or anything like that. But, for most women who are just struggling with kind of milder symptoms and functional changes, I think it's quite empowering to know that what you do day to day in the long term is going to give you better periods in the long term as well.
With periods and endo, I know that many women, and I've come across many clients as well, who do suffer really bad symptoms. However, they are doing the absolute best around like diet and lifestyle. Would that be an indication of where medicine may potentially need to come in?
I mean, sure. So endometriosis is actually a huge swirling topic. It is so massive. And I will do a little drop of another book that everyone should check out. You should maybe have her on your podcast if she has time. So Dr. Peter Wright, she's an Australian gynecologist. She has a book called Healing Pelvic Pain that just came out this year. And she takes a very zoomed out, like she zooms all the way out. It's like, let's think about pain broadly and all the different things that could be contributing to it, including maybe endometriosis. But one of the problems she talks about it in the book, and it's becoming more clear to me now, is the label of endometriosis. Even a doctor having seen endometriosis on surgery is actually not a guarantee that that's what's actually driving the pain. So yeah, I mean, and obviously the treatment for endometriosis has been surgery. And there can be a place for that, yes. But also it's not always needed. And I think, for some of my patients, I'm like, let's just, whoa, the horses here. Like, let's just, slow down before going under the scalpel for this. Like, there can be other options. And I guess on the topic of endo, I mean, that could be a place when period suppression, menstrual suppression with the pill could be an option if it works, although doesn't always work. So the pill is actually, speaking of evidence-based, the pill is not actually evidence-based medicine for endometriosis at all. It's used for it and it can sometimes work, but it's when you crunch the science, and there's not a strong evidence base for that. I will mention the hormonal IUD, Mirena or Kylena, or goes by different brand names depending on the dose, that delivers a medication called levonorgestrel. It's not progesterone, even though it's sometimes called that, into the uterus, and it can relieve pain for sure. Like I think that it can relieve pelvic pain, again, not always, and it is a little different from the pill in that it doesn't always suppress women's own hormonal system or menstrual cycle. It can allow some hormonal cycling, although the progestin, the medication, it doesn't just stay in the uterus, to be clear. It affects the brain, it affects the breasts, it can cause hair loss. So that's an example. I just wanted to, give a plug, not a plug, but like a mention of the hormonal IUD, and that, I guess, for anybody listening who has endometriosis and that has really relieved the pain, then keep going, probably. I think that could be a solution, at least for now. You can still look at some of the other treatment ideas. You can look at the endometriosis sections in my books, and also look at Dr. Peter's book, because it's got lots of other additional ideas.
It's so insightful to have a better understanding of what's happening within a body, because too often, as you mentioned, many women don't understand or don't consciously know that their diet is affecting their hormones. It's affecting their periods and certain lifestyle choices.
Yeah, it affects hormones. It affects the immune system, so it can affect inflammation, obviously. And there's a big connection between what's happening in the gut and endometriosis as well. That's just something to flag. Like, there's almost a 95% overlap between irritable bowel syndrome, IBS, and endo, and that's not coincidental. There's, I would argue, what's the inflammation in the gut is actually driving the pain, to a large extent.
Yeah, wow. So interesting. Speaking of gut health and period pain, I know for a fact you're writing a new book, which is going to be releasing very soon. I would love for you to give an insight for our listeners, what it's a little bit about.
Yeah. Well, the new book, it's not going to be about period pain at all. Actually, it's going to be about metabolic health. So it's about, by metabolic health, I mean, identifying metabolic problems like insulin resistance and what's called metabolic inflexibility, and feeling normally hungry all the time or not having enough energy and perhaps having challenges losing weight. So it's about that. And yeah, it was it's quite, once I spent a year and a half kind of researching that book and digging down into the science around it, I just realized there is so much more to that topic than I realized. It's our body's a regulatory system. So we have a metabolic regulator in the brain that is in charge of a lot of this. So my approach with the book is to actually coax the brain, convince the brain that everything's okay so that it can ramp up energy expenditure, it can, naturally regulate appetite and satiety. So yeah, it's and that does involve, building muscle and changing what you eat and things that are most people kind of have a sense of already. But I guess I'm in the book, I'm going to talk about it from in a different framework. Yeah. So it'll be out in May 2024, hopefully.
Something for everyone to look forward to, because those who are already on that journey of healing their period or looking at coming off the pill or experiencing, perimenopause and menopause symptoms, maybe this is the next best thing for them to maintain healthier hormones around their metabolic health.
This will be really good for anyone in perimenopause, for anyone with polycystic ovary syndrome, or PCOS, even, mood, premenstrual mood to some extent, and anyone, who's been struggling with, wanting to diet or lose weight, this is for them. So yeah, I was quite moved by the writing it, actually, but I just talk about it now. Like, there's just so much more to it. And I do, I feel quite sad now thinking about all the wrong information that's been given to people, I think, and the way, again, women sort of blaming themselves and feeling quite guilty about how their body's behaving and thinking it's something they're, consciously doing wrong, when I think a lot of it's being driven by other factors that can be changed, but that weren't necessarily something that we did wrong. So a big part of it is, of course, many aspects of the modern food supply that we all grew up in, that we're surrounded by, turns out to be far more damaging than we realized.
So. I would love to finish today's conversation on that topic around how we feel guilty about the fact that, they do experience these symptoms, or they think something's wrong with them due to the misinformation. Now, we know avoiding misinformation can't be
right
handled because it's always there. But how can we encourage more women to just feel less guilty, and how can they approach healthier ways about going about their health?
Well, parts of the book I've framed as getting what you need, right? Like, we just have to stop fighting our bodies and start working with them and recognizing that, part of my, I hope this resonates with people, part of my lens is because I was a biologist, evolutionary biologist, before I became a naturopathic doctor. So I do think about things in terms of biological reality. So we're animals and we have certain requirements that we need to meet. Basically, we need to be nourished in the right way with the food that's suitable for us. We need to move, we need to sleep, we need to rest, we need to have social connection. These are things we need. And so I guess I find that quite a helpful way to frame it. And you're always kind of putting it through that lens. I mean, does that make sense that for us as a human, as a the biological species that we are, is this a suitable support for us? And that's actually a part of a broader part of medicine called evolutionary medicine, which is looking at everything through the lens of evolution. What did we evolve to do? And that can actually help to bridge the gap when there isn't science, or when I guess some of the science has been conflicting. I mean, an example might be, I don't know if it's too specific, but we had decades of low fat advice, stop eating fat, like including natural fats from foods, and eat all this like processed garbage. It's like, we should have, like, through the lens of evolutionary biology, it should have been like, does that make sense? If we're an animal that evolved on a certain diet, can we just start, because we've had this idea that this theory about fat, and we should therefore start, like, that didn't work. And so yeah, I think just being realistic about the kind of animal we are can be helpful. I don't know if that answers your question, but that's partly, the way I see it.
It's a good way of looking at it because again, that's also like misinformation that we've been fed for so many years that low
Yeah.
fat is good for us, where in fact
Yeah.
we actually need fats for healthy hormones.
Yeah. I mean, another example, concrete example, I don't know if I'm gonna make people angry with this, but like the other, an exclusively plant-based diet is not a suitable diet for Homo sapiens. I mean, I wish it were. We could kind of like wishful thinking and sort of imagine in some ways how we'd like it to be. But at the end of the day, like we're omnivores, humans are and on that topic, I mean, I think it's totally fine to, eat different amounts of animal. We don't have to all be eating huge amounts of animal protein, but I think to assert that we don't need any is, yeah, incorrect from a biological perspective and from a clinical perspective as well. I guess I'm speaking about patients and, the downward spirals I've seen them go on, trying to follow a diet that is kind of just more an idea than an actual, you know, biological nourishment. So I don't know. Is that are your listeners going to be okay with that? I don't know. I'm not sure. It depends on the podcast how many plant-based listeners are out there.
Yeah,
But
well, I'm on board with that because again, from working with many clients who have been vegan, have been vegetarian, they have noticed the differences in energy and hormonal once they are placing more animal-based products in their lives. And as you mentioned, it's not necessarily eating big amounts of meat.
oh,
But as you said, clinically and biologically, as humans, we do need some form of source of animal product. So again,
okay, good.
yeah, if it resonates with our listeners, awesome. If it doesn't, you can just leave it.
Yeah, just leave that part and look. You can
Exactly.
fast forward over that part. It's too late now, but
Yeah. Oh well, they have the
you can
information.
you can give a little warning. It's like watch at minute 40 something. You just fast forward by 5 minutes.
Lara, I want to thank you so much for jumping on today's podcast. It's
Yeah,
been so insightful, and I'm really looking forward to purchasing your next book this next
yeah.
year.
Thanks so much. I'll try to remember to, email you or send you one, or you can find out from my newsletter. Um, yeah, I'll
I
have a
think
look.
I'm already signed up to your newsletter. I'm always reading your blogs. By the way, for our
Excellent.
listeners, if
Yeah,
you are wanting more information from Lara, I highly suggest getting onto her books. However, she has a flora of information on her website. I will put it in the showcase notes where there's many blogs about various topics that we've spoken about
yeah,
today.
yeah. And I'm going to be doing some more blogging and podcasting kind of now that the book is written. Everything else just went by the side while I, wrote 90,000 words.
That's a lot
So,
of words.
yeah,
A lot of
yeah,
words.
it
Um,
is.
well, girls, if you
Okay.
enjoyed today's
Yeah,
podcast, please make sure that you screenshot it, tag us at the Women's Fitness Academy, tag Lara, tag myself. And then till next time, let's be a little bit more conscious about our hormonal health.